Africa, a land of beauty, a land of life, a land of need. As the world's second largest continent, with more than half the population living below the poverty line, life is hard. But for the hundreds of children who will receive operations in the coming weeks, life is about to get better.
I think if that was my child, I would want people like Operation Smile to come in and do that for me.
Posters plastered around the city announce the arrival of the Operation Smile team. Doctors, nurses, surgeons, and child life specialists work with a local Kenyan medical team to treat children with cleft lip and cleft palate, procedures considered simple, even routine in the U.S. As they arrive at Rift Valley General Hospital in Nakuru, the situation immediately unfolds. Space is small. For the first 2 days, screening will happen in a very cramped 7-room building. Hundreds line up early for their chance to see the American doctors.
People that are transporting children, that are finding medications for us, that are making sure paperwork is going properly, making sure all the pictures get taken and collated and put into the charts properly, and everybody has a job. And there's so many pieces to the puzzle that if you're missing a piece, the puzzle's not complete.
Some children would be sent home, too small, weak, or sick to withstand the strain of surgery. But most leave already smiling at the chance of a new look and a new life. To really understand the impact this opportunity will be for the hundreds of children, all you have to do is look in the eyes of just one, like 18-month-old Onesimus. His mother is a farmer, his father a shopkeeper. They want their baby to grow up smart.
I'm gonna look inside your mouth.
Or 20-year-old Edekwam, who traveled for days by foot from the far borders of Sudan. Kicked out of school for his facial deformity, Edekwam wants a chance to learn and to be accepted.
Forever I will serve the Lord, for the promises I will say amen.
But it was 14-year-old Soleme Kudo who caught our ear and our heart.
I'm 14 years old. I have 5 sisters, 2 brothers. In future, I'd like to be a pilot.
A beautiful girl, an aspiring pilot and singer. She wants doctors to fix her lips so she can sing praises to her Lord. If you get a new smile, how will you feel?
I'll feel happy.
See, the muscle ends right there. It ends over
Surgeon
here,
Dan
and it doesn't
Sellers
have any
declared
muscle
Soleme
right
a
there,
perfect
or very
surgery
little, so we'll be
candidate.
able to help you. It's just an amazing thing that in such a short time you can take somebody who's lived with us for 14 years and make them whole, essentially, and make them just fit right back into all their society, and no pointing fingers and no looking. Is that right? Do people tease you sometimes? Yeah, well, let's fix that, okay?
They do not have anymore.
Surgery day. Soleme's mother waits anxiously outside of the operating room, putting her trust in the delicate hands of strangers. After 35 minutes, the procedure is done. Soleme's mother is brought into the recovery room to see her daughter for the very first time. She peers eagerly around the nurse's shoulder for a look. When her eyes finally rest on her daughter's near-perfect new mouth,
Thank you, Jesus.
Thank you, Jesus.
She's beautiful.
she immediately bows her head and begins to pray.
Katika jina la Yesu aliye Bwana na Mwokozi wetu. Amen.
These missions are from the heart. You know, they're not from your head. They wrench at your heart. Once you've gone on a mission, it's hard not to keep going on a mission. So even though you might see a couple of children or 20 children or 30 children, you know that there are hundreds and thousands of children left to help.